So let's solve these questions. eMRCS abdominal surgery. 18 months old baby. Emergency room. He was found to have bed, nappy filled with dark blood. Hemodynamic is stable. Requires blood transfusion. Prior to the episode, well and necrotizing enterocolitis, anal fissure, esophageal, Meckel's, Crohn's. Because there is no intersusception features of intersusception, Meckel's is the answer in this. Next question is 19-year-old female. Colic, abdominal pain, bloating alternative. This is 19-year grandmother. What is the best course of action? So colonoscopy, digital rectal examination, normal. What investigation you will do? Now fecal calpo. Patient is in alternative constipation and diarrhea. So colonoscopy or fecal calpo. Family history is 87 developed colorectal cancer. That's why sporadic case. Risk of taking population. Fecal calprotectin. So a 2 months old infant, abdominal pain and intermittent obstruction of imaging transverse colon is herniated in thoracic. So that is Morgagni is common. Midline is Morgagni, Bogdale is lateral. Next question is 73-year-old peritonitis, tenderness, left groin, operation, left femoral hernia, perforation, antimesenteric water of the ileum associated hernia. So this is antimesenteric border of the ileum associated with the hernia. The part of the wall is there, so it is Richards. Little says obturator is different, lumbar is different, Richards, and there is some spigelian is different, and there is no Little's hernia is also option there. So Little's hernia involves umbilical, paraumbilical, Little's involves Meckel's diverticular. Little is Meckel. 21-year-old patient with right iliac fossa pain. She put blood-stained vaginal discharge. She is febrile, pulse rate is normal. She has lower abdominal tenderness. So abdominal sonography. Next is examination. She has distended abdomen, hemiflex, some groin pain radiating to ipsilateral knee. So obturator type of hernia. Lower abdomen suffering from the intermittent right iliac fossa pain. Past medical history include negative colonoscopy, is negative iron deficiency, anemia is there, worse with the meals, inflammatory markers are normal. So there is iron deficiency, anemia. Peptic ulcer is possible. Meckel's diverticulum, bleeding is there, that's why. Pain of cholecystitis, palpation. Abdomen patient with cholecystitis experiences pain, right iliac fossa. When patient with cholecystitis experience pain or palpation of right upper quadrant, most during inspiration. So Murphy sign, catch in breath. Next question is 21-year 48 history of worsening right iliac fossa. She has been visited twice on examination, markedly tender right iliac fossa. Examination reveal urine dipstick, blood, WBC count. So this is person having nausea, vomiting twice, appendectomy, laparoscopic. A 52-year lady presents painless mass in the groin. The mass is noted on cuffing. Lateral to pubic tubercle. Lateral to pubic is the inguinal hernia. Painless mass in the groin. The mass is noted lateral to pubic tubercle. 52-year. Below and lateral. Below and lateral is femoral hernia. A 73-year-old lady presents with femoral hernia. Which one of the structure lateral femoral vein? 67 female undergoes ephysectomy for carcinoma of the distal esophagus. She complains of pain and brisk bubbling in the gas drain. When pain, what is most likely cause? Air leak from the lung, anastomotic leak. Air leak from the lung. Next question is, which one of the following intervention is most likely to reduce incidence of intra-abdominal adhesions? Laparoscopic approach. A 17-year-old man identified as a Michel's diverticulum. Which of the following embryological structure is it derived from? Midgut, vital intestinal duct. Seven-year-old boy present with 3-day history of right iliac fossa, pain and examination temperature 39, abdomen is soft, mild, tender right iliac fossa. What is the underlying cause? 7 boy, 3-day history of right iliac fossa, pain, fever, temperature is 39, abdomen is mildly tender right iliac fossa. What is the cause? Mildly tender means mesenteric adenitis. A 14-month child, colic abdominal pain, intersusception. Best course of action is laparotomy. 22-year-old lady, total thyroidectomy for grade 3-6 and develops respiratory stridor, small hematoma in the neck. Reopen the wound. Which of the following commonest cause of acute abdominal pain in non-specific abdominal pain? Which of the condition below is the Bose sign? Closed loop diverticulitis, thoracic cholecystitis. Intermittent right iliac fossa episode diarrhea, 2 kilo weight loss, some right iliac fossa tenderness, most likely is inflammatory bowel disease. Diffuse abdominal pain, 2 weeks since she started contraceptive pill. She has been significant last vomiting, pregnancy test is negative. So this can be acute embolus, inflammatory bowel disease. Diffuse pain since she was started contraceptive pain increased significantly over 10 hours and also with vomitings. Can be ruptured mesenteric vein thrombosis. Lady tender swelling in the right groin, examination tender swelling below and lateral pubic tubercle, cuff impulse, femoral hernia. Below and lateral is femoral hernia. Hepatitis C, present with right groin pain, swelling and a large abscess in the groin adjacent to pulsatile swelling. There is no cuff impulse. So this is aneurysm, false aneurysm. 60-year-old fully attack of pancreatitis, 12 months developed epigastric gastric discomfort, upper GI endoscopy varices, splenic vein thrombosis there. Treatment of choice is splenectomy. 1-day-old infant born with severe respiratory distress. She has scaphoid abdomen, absent apex beat is Brogdale hernia. 72-year man, emergency repair of rupture aortic aneurysm. Only mesh is closed, operated taken to intensive, following 24 hours, nasogastric speed increase and urinary performance, metabolic acidosis, abdominal compartment syndrome. 5-day baby, open appendectomy, 5-year-old baby. Gangrenous of examination, erythema around the wound, some abdominal distension, open the wound. Abdominal ultrasound, okay. "16-year-old present with emergency department, 12 hours history, patient otherwise well, last long 2 weeks ago, examination soft abdomen, and then suprapubic discomfort, pelvic inflammatory, mitral shemach. One-year child, sore throat, fever and several days, periumbilical pain. This is administer antibiotics. 83-year lady present with femoral hernia and femoral, which of the following forms posterior wall pectineal ligament? Seven-month-old vomiting, diarrhea, crying, drawing of the legs, possibly intussusception. 21-year-old admitted tender mass in right iliac fossa. "56-year-old lady, large bowel obstruction, abdominal distension of the following confirms prior to surgery. Which of the following confirmatory tests should be performed prior to surgery? Abdomen CT, barium, large bowel obstruction is there, rectal MRI, CT of the abdomen. 18-year female is there, sudden onset of sharp tearing pelvic pain, small vaginal bleeding. She has complaint of shoulder tip pain. She is hypotensive, tachycardic, cervical excitation, ectopic rupture or extensile torsion. This is possible among the two, rupture, ectopic. History of tearing pain. "25-year-old lady presents with GP 2 days history of right upper quadrant. It is right upper quadrant, fever, white vaginal discharge, 12 weeks, complaining of pelvic pain, dyspareunia. White discharge means pelvic inflammatory disease. Which one of the following is least malabsorption? Least likely to cause malabsorption: pancreatitis, Whipple's, Hartmann. 30-year suspected having appendicitis. Operation of the had operation inflamed Meckel's aortic valve. Which of the following vessel is responsible? Vital and artery. 8-year Caribbean, periumbilical pain, vomiting twice, refusing fluids. Temperature is 38. WBC hemoglobin, WBC count is with neutrophilia. Appendicitis. Oh, sickle cell. Why? Because Caribbean. Hemoglobin is less. That's why sickle cell crisis. "19-year-old lady admitted with lower abdominal examination is diffusely tender laparoscopy perform operation. Multiple fine adhesions are seen between liver and abdominal wall. Codes heads. Which of the following patient has significant retroperitoneal? This is retroperitoneal, great error. Cullen sign is most likely seen in ruptured ectopic. It is periumbilical. A 56-year-old man, 8 days following left hemicolectomy. Left hemicolectomy is done. 56, 8 days. He develops swinging pyrexia. What is the most appropriate investigation? CT scan. IV contrast. "22-year-old man is operated in left inguinal hernia. At operation, sac is open to reveal Michel's diverticulum, which is Little's hernia. Which of the following medial wall of lacunar ligament? A lady underwent a cholecystectomy for drain is left procedure. Next Friday, drain is accumulating the return pile per hour. What is the appropriate PET CT? No, this C. What is that? eRCPS. "11-month girl with sudden onset of abdominal. 11 months, sudden abdominal pain. Mother stated has not been her usual self for past 48 hours. Essentially, she is high-pitched scream and draws the leg interception. "45-year-old man. This is 45-year man. Colic abdominal series of CT scan is done. Demonstrate hernia lateral to rectus muscle at the level of arcuate line, spigelian hernia. "5-year boy found to a Michel's diverticulum episiotomy. It looked to be inflamed. Which type of epithelium? Michel's has got gastric mucosa found to be in the which type of epithelium is gastric or ileal? Okay, mucosa is ileal. Gastric and pancreatic tissue can be seen. When it is bleeding, it is gastric mucosa. 15-month-old girl with 3-day history of periorbital edema. Facial edema, distension abdomen, temperature abdomen, blood, poor perfusion. What is most likely diagnosis? Melanchthonian, bacterial peritonitis, septicemia, loss of immunoglobulin, abstinence in urine. Eight-year boy presents with 4 history of right iliac fossa pain and nausea and vomiting, has been back at the school for 2 days after being kept around flu-like. So this is active observation. A 52-year-old obese lady, painless grape-sized mass in her groin. She has no medical, some varicose veins, cuff impulse and deeper line. This is saphenous varix. A 14-year female is admitted with sudden onset of right iliac fossa pain. She is otherwise normal. She is febrile, urinary dipstick normal. Her previous menstrual state 2 weeks ago normal and pregnancy is negative. What is most likely? Right iliac fossa is there. Metal hemorrhage. It's 2 weeks ago. Menstrual is 2 weeks ago. That's why metal hemorrhage. A 20-year-old man is suspected of having inflamed Michel's diverticulum. And which of the following location is to be found 60 cm from ileocecal wall? First. A 32-year male is noted to have tender mass in right groin. There are also red streaks on thigh. So this one is having tender mass in right groin. There is a mass in the groin and red streaks on the thigh extending from small abrasion. What is most likely? Lymphadenitis, saphenous varix, aneurysm, abscess, lymphadenitis. Lymphangitis, she was telling. Here it is lymphadenitis. Specifically clear cut, it is there. A 78-year-old walking to the bus stop suddenly develops severe back pain and collapses. 78-year-old back pain and collapses. On examination, he has blood pressure 90/40 and abdomen is, she is obese. Man is obese. Soft. Back pain. Collapses. Any reason? Which of the following a feature of IBS? Consistency, pain, relieved by defecation. Sixth finger side. Six-year-old child present with colic abdominal. 6 year is there. Passage of red currant jelly. Examination data right iliac fossa. Intersusception is there. Inflammation of pair or beacons. What is that? Which of the following below is least recognized to be precipitant? Polyps can go, mesenteric cyst, cystic fibrosis, Pairs patches, Mickels, polyps, mesenteric cyst. A 56-year-old lady is having colic abdominal pain. Now colic abdominal pain, plain X-ray performed. Which of the following should not show fluid levels in plain? Stomach, ascending colon, descending colon. Descending will not give, fluid level in the stomach will be there. A 75-year-old sudden onset generalized abdominal pain, single episode of bloody diarrhea, atrial fibrillation is there, diffuse tender abdomen, ischemic colitis, mesenteric infarction second is there. Ivor Lewis use of adjective for carcinoma distal liver, pale opacine fluid is located draining from the right chest, it is chyle leak. Which of the conditions is called Rossing sign most likely to be absent? Advanced sickle cancer, parappendicitis, right side diverticulitis, retrosickle appendicitis, severe Crohn's disease, sickle cancer or retrosickle appendicitis. Advanced right iliac fossa pathology can result positive line, however, in retrosickle appendicitis may be absent. The fact contribute to delayed diagnosis. Undue weight is placed on the presence of sign. Rossing sign, appendicitis. 78-year lady present with colic abdominal pain, tender mass in her groin. There is small firm mass lateral to pubic altar. Incorrect fibroid hernia. (50 undergoes reverse loop colostomy. Reversal of the loop colostomy occurs while discharge and symptoms of vomiting, colic abdominal, Swelling at the loop and tender herniation. Incisional hernia obstructed. 8-year-old boy examined by doctor. Routine clinical exam. Doctor smooth swelling in the right iliac fossa and mobile. Otherwise, what is most underlying cause? Mesenteric. 8-year boy smooth swelling is mesenteric cyst. 32-year pregnant. Suspected may be perforated abdominal viscera. What is most operative course of action? Laparotomy. Okay, CT scan. 72-year lady is suspect having femoral hernia. Which of the following is most likely site to be identifiable? Below and lateral.